Hi, everyone. As an immunologist, I'm always looking to share knowledge that can help those of us that are immunocompromised and therefore more susceptible to the many pathogens floating around us all the time. Since September is Gynecological Cancer Awareness Month, I've invited my good friend, Dr. Lisa Abaid, an OBGYN with subspecialty board certification in gynecologic oncology, to discuss this vulnerable population. Hi, Lisa.
Hi, Andrea. Good morning. Thanks for having me. The subject is very close to my heart because many of my patients are receiving types of treatment for their gynecologic cancers, including chemotherapy, which, as you know, can suppress their immune system and make them far more vulnerable to infections.
Exactly. I always educate my audience on the role of vaccines in immune health. And with flu season right around the corner and a global pandemic in the not so distant past, what precautions do you advise your patients to take as they begin their cancer treatment?
I tell my patients undergoing chemotherapy that their immune system might suffer from it, and it's important to receive vaccines in advance. Non-live vaccines are one of the things we consider before starting treatment, which would include things like COVID-19, RSV, influenza, excluding the nasal mist form, which is a live form, and shingles.
Yeah, I'm so glad you mentioned shingles. For those that don't know, anyone previously infected with the chickenpox virus, also known as the Varicella-Zoster virus, can get shingles because the virus establishes latency after that primary infection. I've personally had shingles, and let me tell you, it was awful. My torso was covered with this painful rash. Even my shirt fabric brushing against it was excruciating. On top of that, I had other flu-like symptoms, fatigue, fever, headache. And my case would be considered a typical one. And it still took me several weeks to feel normal again.
Yeah, shingles is no fun, and women are already more vulnerable to shingles. So, as we know, my patients who are undergoing chemotherapy for gynecologic cancer have even a greater risk of shingles.
Breast and gynecological cancers impact many patients. What do we know about the risk of shingles in those patients?
So, we know the incidence of shingles is particularly high in the first 2 years following their cancer diagnosis. And then adults on immunosuppressive therapies can have more severe and more long lasting rashes compared to immunocompetent patients or patients with normal immune systems. And they're more likely to experience complications. One of the most common complications is postherpetic neuralgia, which is nerve pain that can last for months or even years after the rash resolves.
Yeah, it sounds horrific. I mean, undergoing chemotherapy is hard enough. Having shingles and possibly a complication like postherpetic neuralgia on top of that seems unimaginable and can significantly impact a patient's quality of life.
It sure can. And about 30% of people who are hospitalized with herpes zoster have a compromised or suppressed immune system.
So, what do you recommend?
Well, prevention is always best. So, preventing the reactivation of the herpes zoster virus is really the only well documented means of preventing shingles and its complications. And the CDC recommends herpes zoster vaccination to prevent shingles, both in immunocompetent adults, people with normal immune systems over 50, but anyone over 19 who is or will be immunodeficient or immunosuppressed because of disease or therapy should be vaccinated as well.
Let's make sure that patients and physicians are aware of the virus, its complications, and its preventive measures. Lisa, I cannot thank you enough for coming to share your knowledge with my audience.
You're so welcome. And thank you for highlighting the struggles of the immune compromised population.
Yeah, absolutely. It's so humbling to think of the risks your patients undergoing chemotherapy for gynecological cancers face every day. I appreciate you giving voice to their experience.
Thank you.